What is trichotillomania? How does it affect people? And how is it treated? Trichotillomania, or hair pulling disorder, often shortened to trich, is a mental disorder characterised by an irresistible urge to pull out hair from the scalp or other places. People with this condition may feel rising tension until they pull out a hair, at which point they experience a sense of relief, but others aren't even aware they're doing it. Hair pulling was first described by Hippocrates, known as the father of medicine, as a manifestation of grief, and also by the philosopher Aristotle, who saw it as a bad habit that should be resisted. It is referred to in the Old Testament and in Shakespeare's Romeo and Juliet, and the phrase "tearing your hair out" is a familiar expression for exasperation. The name trichotillomania was coined by French dermatologist Dr. François Alloppeau in 1889 from the Greek. It remained a largely dermatological condition until the 1950s, when reports of successful treatment by psychological methods began to appear, and in 1987 it was included in the American Psychiatric Association's Diagnostic and Statistical Manual. Hair pulling is usually confined to one or two sites, but it can be from anywhere on the body. The most common pulling site is the head, followed by the eyebrows, eyelashes, face, arms and legs. Less common sites are the pubic area, beard, chest and underarms. Generally, hairs are plucked out one at a time, but some people pull out small clumps. Often, the pulling occurs in focused binges that can go on for several hours. But for others, the pulling happens when they are relaxed and alone, often lying in bed or watching television, even drifting off to sleep. Some people roll the plucked hairs in their fingers or suck the root in a particular way. Everybody is different. It has nothing to do with plucking or shaving unwanted hair for cosmetic reasons. It is a serious condition that can cause intense emotional distress and impairment of social functioning, which can lead to anxiety and avoidance of going out and clinical depression with feelings that life is not worth living. Trichotillomania is often very obvious to others, and this can lead to feelings of shame and low self-esteem. So sufferers may be secretive and try to hide their condition by wearing hats or lots of makeup or dark glasses. They may have large bald patches on their heads, sometimes referred to as friar tuck alopecia, which is usually on one side more than the other. People with trichotillomania may also do skin picking, nail biting, lip or cheek biting, and nose picking. And collectively these are known as body-focused repetitive behaviours. Hair pulling can lead to medical complications such as permanent hair loss, infection, repetitive strain injury of the wrist, and even gastrointestinal obstruction by hairballs from swallowing hair, known as trichophagia or Rapunzel syndrome, which can be fatal if not recognised in time. The prevalence of trichotillomania is between 0.6 and 4% of the global population. It most commonly starts around puberty, but it can be earlier, and it may persist as a lifelong problem. It is 10 times more common in females. The exact cause of trichotillomania is not clear. Behavioural psychology theorists see it as a coping behaviour in response to stress that has been reinforced through tension reduction. Others regard it as a form of self-harm. Psychoanalysts talk about their usual sexual conflicts, but there is increasing evidence that it is actually a neurobiological condition involving the dopamine, 5-HT, GABA and possibly glutamate neurotransmitter systems. It is more common in families with OCD and impulse control disorders, and mutations of specific genes have been found in familial cases which are associated with abnormalities of the so-called OCD circuit. Episodes of hair pulling occur more often at stressful times in people's lives, and some studies link the onset to the hormonal changes of puberty and monthly variations to the menstrual cycle. Self-help techniques can be tried first, and these include all sorts of things from using a fidget toy, squeezing a stress ball, repeating a phrase out loud until the urge to pull has passed, and trying essential oils. More persistent cases may benefit from being treated by a clinician familiar with the condition. A number of different psychological approaches have been used, including mindfulness, cognitive behavioural therapy, and family therapy. Medication, including SSRI and other antidepressants, and some new approaches targeting glutamate and endocannabinoid receptors have also been tried with some success. but most studies so far have been on small samples, limiting the conclusions that can be drawn. So the message is, don't suffer in silence. Talk to someone. You're not alone. Thank you for watching. Trichotillomania explained in 5 minutes. Please like and subscribe and let me know if you have any suggestions for future topics. Cheerio for now.